only we lived in a world where everyone had the same access to the same care. Didn't make any difference if you were rich or poor, were a kid or an adult, lived in a city or a rural area, or the color of your complexion, were on the darker side or on the lighter side. Well, unfortunately, that's not where we are here in the United States. Might be true in some countries, but not here. Here, we live in a place that is almost 180 degrees opposite of that. There are disparities in healthcare that persist across every disease, but they're really exaggerated when it comes to obesity, and especially childhood obesity. So I'm just going to use bariatric surgery in children as an example to illustrate this point. But you can really extrapolate these data to adults with obesity, and really with all of the expensive care that we see here in the United States. So with respect to bariatric surgery, there are differences in insurance coverage. And again, that holds true for not just adults and kids, but your private insurance plans, your public insurance plans, even private insurance plans that are purchased by different companies that you might work for. So the take home there is you got to check your insurance plan to see what's covered and what's not. But when it comes to children and bariatric surgery, insurance coverage was something I fought for 20 years. And even when children meet the recommended requirements, there are insurance plans that just won't cover surgery or even cover the medications for patients who are under the 18 years of age. Cutoff. Doesn't really make sense, but that's what they do. There are also data out there that show that children who are Black or Hispanic are less likely to undergo bariatric surgery, which should be the opposite, because those particular communities are at higher risk and have higher rates of obesity when compared to white kids. Then there are data that show that Medicaid insurance coverage is associated with less utilization of bariatric surgery for adolescents, again, in that Black and Hispanic patient population, compared to if those same people were to have private insurance. But opposite to that, Medicaid insurance is associated with increased utilization of bariatric surgery when it comes to white kids. So it's obviously not just insurance that's driving these differences, but might be doctors recommending the procedure or communities thinking positively or negatively about a certain surgery. So if you look at this next image or this next graph, it's a map of the United States. And I put it up here to show that geography also plays a huge role when it comes to disease rates, but also when it comes to access to care. So as you can see, states that are in orange or deeper orange are the states that have the highest childhood obesity rates in kids ages 10 to 17. The Sun Belt is always the leader of the pack when it comes to obesity rates, and it's no different when it comes to kids. Now, what's interesting is that some of these states that have the highest prevalence of childhood obesity actually have the fewest number of surgeons who are willing to treat them. So that's what this graph shows. And as you move to the right along the x-axis, that is the prevalence of childhood obesity within that state. And if you move down on the y-axis, it's the number of surgeons. So you can see the very last circle in the graph is a state that has about 24% prevalence of childhood obesity and no surgeons in the state willing to treat them. This next map is just another way of showing the same thing. The states in red have the fewest number of pediatric surgeons or bariatric surgeons who are willing to treat kids, and some of them are in the Sun Belt, again, where the highest need is. So there's a complete disconnect between need and the people who can provide the services that are required. Again, this is specific to childhood obesity and bariatric surgery, but the same message and the same data can be found with a bunch of different diseases, including adult obesity. It's this mismatch between the need for care and the ability to get that care. And it's skewed towards urban centers because that's where universities and the hospitals tend to be, and against the rural communities. But the rural communities have huge need and nowhere to get the care. So we need to really think about as a country how to improve access to care for all Americans with obesity, whether they be kids or adults, whether they live in the country or in the city, whether they have a darker complexion or a lighter complexion, it shouldn't matter. Everybody should get the care they need. Now, I'm not necessarily advocating for nationalized healthcare. Can have an episode on that if you guys want to talk about the pros and cons of that kind of system. But I do believe we need a baseline or a base level of care for everybody in America so that we can really, again, change the trajectory of obesity rates in America, because without obesity treatment, we are never going to have any obesity or meaningful obesity prevention. So if you want to hear more about how obesity treatment can be obesity prevention, of course, you can always just subscribe to the channel and have access to all the episodes. So please give me your comments and feedback. Love to hear from you.